Hello, I'd like to share a particular case I had during my second internship at a rehabilitation clinic. I'll explain the patient's primary diagnosis, their prior medical history, a couple of their goals, the treatment techniques applied during intervention, and a brief demonstration on how to use some of the materials used during treatment. I'd like you to meet John Doe. Mr. Doe was a 75-year-old male with a primary diagnosis of pneumonia and shortness of breath. He was admitted to our facility after being discharged from the hospital. He had been receiving skilled services for about 3 weeks prior to when I began with him. Mr. Doe passed during my internship. However, he was easily one of my favorite adult patients. Mr. Doe's primary medical history includes recurrent aspiration pneumonia, pleural effusions, which is a condition in which excess fluid builds around the lungs, throat cancer, esophageal stenosis, which is something we learned during a Rignacs class, respiratory failure, gastronomy status, atrial fibrillation, which has to do with rhythmic contractions of the cardiac atria, CAD, which is coronary artery disease, anemia, bacteremia, which is the presence of bacteria in the blood, diabetes, transient ischemic attacks, a PEG tube for 2 years, which is an endoscopic medical procedure in which a tube is passed into the patient's stomach through the abdominal wall in order to provide a means of feeding when oral intake is not adequate, which in Mr. Doe's case, his swallowing is not adequate. Mr. Doe also presents with thrush, which is an infection caused by a fungus and can occur in different areas of your body. In his case, he had oral thrush. For those of you who don't know what that is, I'll show you. So some of these pictures are actually very mild compared to what I've been exposed to during my internship. Oral hygiene is a very important part of our field, meaning sometimes it is our responsibility to educate CNAs and nurses about the importance of oral hygiene and oral maintenance. And unfortunately, there may be times that you may need to clean this kind of plaque buildup depicted in the picture furthest to the right before you can even accomplish your intended therapy with your patient. And usually the plaque buildup I've seen is brown and much thicker. And I don't know if this is the right wording, but it looks like you could even like flake it off, like just take pieces of it off. But don't let this fool you. This buildup could be just from a day. So be especially aware of your PEG patients. And remember that you're also there to advocate for your patients and ensure that they receive the proper oral hygiene they deserve and need. So in these pictures, you have a normal tongue from the left, and then you have a picture of thrush, and then the following picture is also thrush, which is that infection that I was telling you about. And then that last picture is something that's referred to as just plaque buildup, and it's pretty gnarly. Mr. Doe's plan of treatment consisted of just a couple short-term and long-term goals. The one that I'm focusing on here is similar in reference to which the short-term and the long-term. So for the short-term goal, it's to just increase the ability to use swallowing maneuvers in order to improve airway protection, in order to eventually decrease risk of laryngeal penetration and aspiration, and through the use of these facilitative techniques that increase safety and protect airway, like I said. So the long-term goal is exactly the same. However, the level of cueing and is what's different. The ability is going to still maintain its severe rating, just the cueing is just a little lower for the long-term goal. So some of the things that we worked on with Mr. Doe was oral motor exercises as well as pharyngeal strengthening exercises. The exercises that I'm going to show you in the next slide are just exercises that help strengthen and coordinate the muscles that are involved in swallowing. Here are some pharyngeal strengthening exercises that you can use with your patient. I'm going to talk a little bit about the effortful swallow, the Misako maneuver, and the modified Shakir exercise. Sometimes the best practice for swallowing is swallowing itself. The effortful swallow is also known as the hard swallow, or sometimes known as the modified Valsalva. Therapy techniques are usually classified as being either indirect or direct. And indirect just means that it can be done without food used, whereas direct therapy techniques are used during swallowing of foods or liquids. The effortful swallow, though, can be used as an indirect or a direct therapy technique. The effortful swallow is, as you may recall, when you exaggerate your swallow by tightening your neck muscles. I usually tell my patients to pretend to swallow a grape whole, because imagine swallowing a grape whole without chewing it. You would need to put in a lot of effort to just push down that grape. The Maselko maneuver is similar, but you're going to direct the patient to stick their tongue slightly out and just hold it down without hurting themselves. Hold it down with either their teeth or their lips or both, and then swallow in that position. But that is a controversial technique because some SLPs argue that it's not a functional task since we don't stick out our tongue when we swallow. However, others feel that it is a great exercise in order to strengthen PPW, posterior pharyngeal wall, and base of tongue, BOT, contact. And the modified Shakir is just an exercise that you can use to strengthen the piriform sinuses in order to reduce the residue in the piriform sinuses. The actual Shakir exercise is done laying down, but the modified Shakir, sometimes you just can't get them to lie down. Maybe they're in their wheelchair. It's just difficult. You're not going to get them out of their wheelchair. One, you can't take them out of their wheelchair, but you're not going to get them on their wheelchair and then lie them on the ground or lie them on their bed. So modified Shakir just means that, we did two types of modified Shakirs at the facility that I was at. One of them was using a foam ball and putting it under the patient's chin and just having them push down all the way. It's like to get their chin almost, you could tell them to get your chin to your sternum. I mean, that's pretty hard. That's going to take a lot of effort. And what that does is it's going to tighten your neck muscles and your piriform sinuses, like they're just going to close up. So that's something that you can work on. These are overall great exercises to do with individuals who have known pharyngeal weakness. Simply put, if you've had an MBS and the findings were incomplete contact between the PPW and the BOT, this exercise might be the one for you. The modified Shakir, for example. If you haven't had an MBS but have pooling of saliva or food in your throat, which might be noticed by a wet or gurgly voice quality, then these exercises in general might benefit you also. Some other pharyngeal strengthening exercises that we used with Mr. Doe included the pitch glides, the Valsalva, and base of tongue retraction exercises. The literature is going to differentiate between the types of pitch glides that there are. So, for example, the pharyngeal squeeze maneuver, also known as PSM, generates a forceful and effortful E sound to stimulate contraction of the pharyngeal constrictors. And then the effortful pitch glide, the EPGs, produces the E sound, however, with a steadily increase to the highest pitch. And once it's reached, you apply more effort to generate a forceful E sound. So at our clinic, for example, we would do E and just hold that E sound. And we would obviously repeat that several times. The Valsalva is used to improve airway closure and prevent aspiration, and it applies to patients who exhibit laryngeal aspiration with liquids and foods during the swallow. So you can do like a breath hold, a pull with breath hold, a push-pull with breath hold, or a pull breath hold. Yeah, so the three. For the breath hold, you would take a breath, bear down and hold your breath, and you should not hold your breath with your lips, but more in your throat. Like you do as if you were trying to lift something really, really heavy. Okay, and then you would relax. For the push-pull, you would place one or both hands under your chair and pull as if you're trying to lift your chair up with you in it. Again, while holding your breath. Okay, you can also do that one, for example, up against the wall, or you can sit and then put your hands out in front of you, both hands, and push against the clinician and do that with the clinician. The base of tongue exercises are done in order to improve the base of tongue movement and strength in order to improve or better propel the bolus, whether it be food or liquid, and applies to patients who exhibit reduced tongue base and pharyngeal wall movement, and also with patients with molecular residue. You can do exercises like gargling, like pretending to gargle, so look up toward the ceiling and gradually increase the duration of the gargling time. A lot of patients have a difficult time achieving the gargle sound, so you might have to break it down. So for example, some patients I had were really, really weak, and we would just have them do like a hard go sound, like go, go. So it's like the beginning part of the gargle. And it's just to get, again, that movement of tongue base retraction or base of tongue retraction. You can also do general tongue base retraction exercises, which is pulling the back of your tongue as far back as you can and pretend you're trying to scratch the back wall of your throat with the back of your tongue. Oh, and the pretend to yawn. You would just open your mouth very wide, start to yawn or pretend to yawn, and you're going to feel all the muscles open wide in your throat. That's going to help with the opening of the UES, the cricopharyngeal muscle. It's going to help open that up, so that's a pretty good one to use also. Here are just two important materials you'll need handy during some therapy sessions, especially for PEG patients. On the left, there's a box of Dynarex lemon glycerin oral swab sticks that come 3 swabs into 1 packet. You can freeze these packets and use them as thermal gustatory stimulation, or if they're not frozen, you can still use them for gustatory stimulation. These swabs can be used, for example, to assist during swallow initiation timing tasks, or to even help produce saliva in order to complete pharyngeal strengthening exercises like the effortful swallow. I've used them also to help clean out oral mouths, oral cavities, when they have that buildup that we showed earlier, or that I showed earlier. Sometimes that helps kind of loosen up that plaque buildup. And on the right, there's a picture of the Toothette's oral swabs with mouth refresh, and each of the green packets come with 2 single-use, or actually the whole thing is just a single-use device which contains 2 sponge swabs with antiseptic oral rinse. They're pretty neat. I'll show them in the video following this PowerPoint. All right, so I'm going to go ahead and demonstrate some of these materials so you can just have a better understanding of how they look and how they're used generally. But they're pretty versatile. You can also, I just remembered, you can also use the lemon glycerin swabs to help when you're doing oral motor and you want to provide just thermal gustatory or tactile stimulation so that they can know, for example, if you want them to lateralize their tongue, you would tap the front of their tongue, the tip of their tongue, and you would tap the edge of their mouth that you want the tongue to go towards. So that kind of helps with lingual awareness. It's going to help improve or increase lingual and oral motor in general, strengthen tone, coordination, range of motion. It's going to help with all of that. Okay, so that concludes my PowerPoint presentation. I'm going to now show you a clip, just a really brief demo on how to use those materials that I had showed previously. If you have any questions, you can email me at the email listed on the slide. Okay? All right, have a good one.